Hello, I'm Dr. Claudia Fede Spicchiale, and today I'm going to present the study Urodynamic Predictors of Daytime and Nighttime Urinary Continence for Robotic and Open Orthotopic Ileal Neobladders, results from 2 tertiary care centers. I have no affiliation to disclose, and we can start with the study. Orthotopic ileal neobladders are becoming increasingly common urinary diversions after cystectomy for bladder cancer. However, reliable data on functional outcomes of these pouches are lacking, and these may be dependent both from the different surgical techniques used and the surgeon's experience, and the lack of standardization in reporting functional outcomes. Therefore, possible predictors of continence for orthotopic ileal neobladders are unknown. We wanted to investigate if there are predictors of urinary continence for robotic and open orthotopic ileal neobladders, and we wanted to identify them. This study focuses on the urodynamic results and the epidemiological data of 66 patients with orthotopic ileal neobladder who underwent a complete urodynamic evaluations. The urodynamic profile was considered completed when included uroflowmetry, systemanometry, residual peristaltic activity and pressure of the residual peristaltic activity profile, compliance, and lick point pressures. We calculated the daytime and nighttime continence rate, and then we ran some statistical analysis like using Kaplan-Meier curves and Cox regression analysis to identify possible predictors of daytime and nighttime urinary continence. Comparing the continence rates between genders, we found that males achieved higher continence rates according to our Kaplan-Meier curves. Also, at univariable Cox regression analysis, male gender was a predictor of daytime urinary continence. Then we analyzed other data like age, BMI, smoking status, and surgical approach, open versus robotic surgery, finding that actually at multivariable analysis, none of those could be considered a predictor of continence or incontinence. Analyzing the urodynamic results, we noticed that actually neobladder residual peristaltic activity, so the presence of residual peristaltic activity due to residual peristalsis of the ileum, and maximal neobladder pressure over 50 water centimeters were independent predictors of nighttime urinary incontinence, both at multivariable Cox regression analysis and at Kaplan-Meier curves. In conclusion, our data suggested that male gender seemed to be associated with better daytime urinary continence rates, while the presence of residual peristaltic activity and a maximal neobladder peristaltic pressure over 50 water centimeters are linked to nighttime urinary incontinence. This suggests that medical treatment of the increased pouch activity due to a residual bowel peristalsis may enhance night continence rate in orthotopic ileal neobladders. Thank you for your attention.